Have you ever wondered what exactly a stomach infection is and how it affects your body? Welcome to our deep dive into the world of stomach infections, a prevalent health issue that's often overlooked. Recognizing these infections, understanding their causes, symptoms, types, diagnosis, and treatment are crucial for maintaining good health. We'll also touch upon some effective home remedies. So, are you ready to explore this fascinating world of gut health? Stay with us as we delve into the intricacies of stomach infections and how they impact your health. So, what exactly triggers a stomach infection? Well, there are a few culprits that we can point to. The most common causes are bacteria, viruses, and parasites. Bacteria like H. pylori, Salmonella, or E. coli can wreak havoc on your digestive system, leading to inflammation and discomfort. Viruses such as the norovirus or rotavirus are also frequent offenders. Lastly, parasites like Giardia can be acquired from contaminated food or water. Now let's talk about how these bad guys make their way into your system. Poor hygiene and contaminated food or water are the primary pathways. Not washing hands properly, eating undercooked or spoiled food, or drinking unsafe water can open the door to these unwelcome guests. Remember, your stomach is like a fortress and you want to keep the invaders out. Now that we know the causes, let's explore the symptoms that could hint at a possible stomach infection. How would you know if you have a stomach infection? Let's find out. Stomach infections often present a range of symptoms that can be quite uncomfortable. The most common ones include diarrhea and vomiting. This happens as your body tries to expel the infectious agents causing the upset. You may also experience a stomach ache, which is caused by the inflammation in your gut. Often the pain can be sharp and cramping, and it might get worse after meals. A fever is another telltale sign. When your body's immune system detects an infection, it raises your body temperature to create a less hospitable environment for the bacteria or virus. The severity of these symptoms can vary from person to person and depends on the type of infection. Some people may have mild discomfort, while others could be seriously ill. Recognizing these symptoms is the first step towards diagnosis and treatment. Did you know there are different types of stomach infections? Let's dig a little deeper into this. One common type is gastritis, an inflammation of the stomach lining, often resulting from a bacterial infection. It can cause severe discomfort, but fortunately it's usually treatable with antibiotics. Then there's gastroenteritis, often dubbed as stomach flu. This is inflammation of both the stomach and intestines. It's usually caused by a viral or bacterial infection and can bring on symptoms like nausea, vomiting, and diarrhea. Another type is peptic ulcers, painful sores that form in the lining of the stomach, upper small intestine, or esophagus, often due to a bacterial infection or long-term use of pain relievers. And let's not forget about stomach cancer, a more severe condition that starts in the cells lining the stomach and can lead to serious complications if not detected early. Understanding these types can help in the diagnosis and treatment process. A proper diagnosis is crucial for effective treatment. So how do doctors diagnose a stomach infection? Let's dive into that. The diagnostic journey often starts with a thorough physical examination. The doctor may check for tenderness, swelling, or abnormal sounds in your abdomen, as these could indicate an infection. Next, stool tests might be performed. These tests are helpful in detecting the presence of harmful bacteria, viruses, or parasites. A sample of your stool is collected and sent to a lab where it's meticulously examined for these culprits. In some cases, a procedure called an endoscopy may be required. This involves a thin, flexible tube with a camera, known as an endoscope, being gently inserted down your throat. This allows the doctor to visually inspect your stomach and potentially identify the source of the infection. Diagnosis isn't a one-size-fits-all process and may require a combination of these methods. But remember, once a diagnosis is made, a suitable treatment plan can be implemented. What options are available for treating stomach infections? Now that's a great question and one we're going to dive into right now. When it comes to treating stomach infections, the approach largely depends on the type of infection and its severity. For bacterial infections, antibiotics are the go-to treatment. These powerful drugs work by killing the bacteria or stopping them from multiplying, thereby helping your body to fight off the infection. Antiviral medications, on the other hand, are used to treat viral stomach infections. They work, by interfering with the virus's ability to multiply, slowing the infection's progress and giving your immune system a chance to respond. But what about when you're dealing with a stomach bug that's causing vomiting and diarrhea? That's where hydration therapy comes into play. This treatment involves replacing lost fluids and electrolytes to prevent dehydration, a common and potentially dangerous complication of stomach infections. This could be as simple as sipping on a rehydration drink, or in severe cases, it may involve intravenous fluid replacement in a hospital setting. Now, let's talk about probiotics. These are beneficial bacteria and yeasts that live in your body, and they play a crucial role in maintaining your gut health. Some studies suggest that taking a probiotic supplement can help to restore the balance of good bacteria in your gut following a stomach infection, potentially speeding up your recovery. And of course, don't underestimate the power of good old-fashioned rest. When you're ill, your body uses a lot of energy to fight off infection. Resting allows your body to focus its energy on healing, so don't feel guilty about taking it easy while you recover. So there you have it: antibiotics, antiviral medications, hydration therapy, probiotics, and rest. These are all important tools in the battle against stomach infections. While medical treatment is necessary, there are also some home remedies that can help. But more on that in the next segment. Did you know that certain home remedies can help manage symptoms of a stomach infection? Indeed, while these remedies are not a substitute for professional medical treatment, they can provide some much-needed relief and support recovery. Firstly, hydration is key. When battling a stomach infection, your body can lose fluids rapidly due to symptoms like vomiting and diarrhea. Rehydrating with water, herbal teas, and rehydration solutions can help replenish lost fluids and electrolytes. Secondly, your diet plays a significant role. Opting for bland, easy-to-digest foods can ease the burden on your digestive system. Think bananas, rice, applesauce, and toast, affectionately known as the brat diet. And then there's heat therapy. Applying a warm compress to your stomach can help alleviate discomfort and pain. But remember, the heat should be soothing, not scalding. Fermented foods such as yogurt and pickles are also worth mentioning, as they contain probiotics, beneficial bacteria that can help restore balance in your gut. And of course, rest. Your body needs energy to fight off the infection, so make sure to get plenty of sleep and avoid strenuous activities. But let's not forget the cardinal rule. These remedies should complement, not replace, medical treatment. A stomach infection is a serious condition that requires professional attention. Remember, it's always best to consult with a healthcare professional if you believe you're suffering from a stomach infection.